I'm Dr. Kelly Starrett with H-Wave. One of the hidden aspects that unlocks real healing potential is nutrition. Now, one of the things that we see when we're managing chronic pain, when we're managing injury, we're managing surgery, is that we oftentimes very much lose our loci of control, that a lot of the sort of processes and relationships that make me me in my world and my work and my family sort of are highly disrupted. And one of the things that we've noticed is that if we can get athletes to focus, get people to focus on certain other behaviors, we start to feel like, hey, there's something I'm in control and there's something I'm doing that's naturally going to help my healing or give me some agency towards a better healing response. The research is pretty clear that when we're in these surgery, post-surgery situations or injury situations, we actually want to dial up our protein intake. And we're trying to get to the sort of what seems like a lot of protein, but it's actually quite reasonable. It's 1 gram of protein per pound body weight. And what that does is a couple things. One is it gives my tissues everything they need to rebuild, all the connective tissue. I'm not just talking about muscles, but all of the connective tissue, all the other aspects of that system. We also are seeing that with higher supplementation of protein, we're able to hold on to our native muscle mass. And that's really important because we all know it's quite difficult to build muscle. And one of the things that happens with immobilization and inactivity, certainly prolonged immobilization, is that it's easy to lose muscle very quickly. So if we can dial up this protein during that time, it makes a big difference. We also know that protein has a high satiety index. So when I eat protein, I feel full, which means I might not be reaching for that box of cereal or that carton of ice cream because I'm sort of bored and laying around the house. So it's one of the ways that we get a little bit of calorie control built into our athletes during this time of injury and surgery. The second thing we really want to try to focus on is trying to eat more fruits and vegetables. We try to get 800 grams of fruits and vegetables in the people we're working with, especially in times of surgery and trauma and recovery. And we do that for a couple reasons. One is that we're trying to increase our fiber always, but really we want to make sure that we have enough micronutrients on board to facilitate a full healing response. Remember, you're either going to heal at the rate of a human being, the maximum rate a human being can heal, or you might end up rate limiting that healing process through a bunch of other errors because I'm not getting enough sleep, or it's impossible to sleep with this pain, or hey, my nutrition isn't on point, hey, I'm not decongesting an area. Again, my body's probably going to heal, it'll just heal slower. So if we're trying to maximize the impacts of surgery, impacts of trauma, and maximize our abilities to sort of leverage the incredible healing response of the body, trying to get your protein up to 1 gram of protein per pound body weight, and trying to get 800 grams in fruits and vegetables, however you like, you'll find that we're turning the dials to 10.